Hi, this is Marty Stempniak, staff writer for Hospitals and Health Networks. The country's hospitals are working harder to monitor and increase diversity from the C-suite to the board table, but there's still a long way to go in terms of completely eliminating disparities in care. Today, I'm joined by Fred Hobby, President and CEO of the American Hospital Association's Institute for Diversity, which recently surveyed 924 of the nation's hospitals to see how they're tackling this issue. Fred, thanks for your time today.
Thanks for having me.
So what are one or two of the key takeaways?
Well, I think first of all, the number of hospitals that participated in our survey was certainly a significant increase. The last time we did this survey, which was actually the first time we did this survey in 2009, we only had 182 hospitals participate. It was really hard to draw any conclusions from such a limited response pool. So I think the fact that this time we had over 900 hospitals participate in the survey, it both gives credibility to the data that we have, but it also speaks to the growing interest that hospitals have in this topic, which is very encouraging to those of us who work in this field.
So how does this compare to how things were 10 or 15 years ago? Have hospitals come a long way?
Oh my, 10 or 15 years ago, people didn't even want to discuss diversity. Generally, not to mention in healthcare. There were some limited efforts on the part of a few pioneering hospitals. I had the good fortune of working for one of them. The Greenville Hospital System in Greenville, South Carolina, was actually one of the first hospitals in the country to establish a formal diversity office with a vice president, a budget, a staff, to begin to tackle these questions around diversity in management, diversity in the workforce, and the elimination of disparities. So 10 or 15 years ago, this topic in healthcare was hardly addressed. The private sector, on the other hand, was setting records and doing data collection and really advanced. But I'm really pleased to say that today, the healthcare industry has really caught up with the private sector in terms of programs, services, awareness raising. We have really made up a lot of lost ground in a short period of time. We still have the challenges, but the level of awareness, the commitment to do something in this space, diversity management, disparities elimination, we have come a long way.
One thing that struck me was the disparity between the number of hospitals that collect data on race and ethnicity and the number that actually use it to benchmark gaps in care. I mean, why collect the data if you're not going to use it meaningfully?
There are a couple of theoretical answers I can give you because it's hard to speak for 900 hospitals or even 5,000 hospitals. I think one of the considerations, actually a concern on the part of hospitals, is that acknowledging the fact that they have disparities in their delivery process, delivery of care, or in their medical outcomes could be a public relations issue if that got outside. I think some other hospitals might view it as a liability issue. Some hospitals, because of their financial status, really don't have the technology in place yet to begin to actually do the in-depth analysis to identify these disparities by diagnosis or gender or race. So collecting the data is a great first step, collecting race, ethnic, and language preference data on the part of your patients. There are a number of challenges that hospitals, some psychological and some technological, that may be holding hospitals back from actually using the data to address disparities. I think one thing is perfectly clear, however. There are numerous components in the Health Reform Act that are going to be pushing hospitals in terms of reimbursement to begin to address these challenges head on.
So if I'm a hospital CEO, why should this stuff matter to me? I mean, why should my executive leadership team and my board mirror the community that I'm serving?
Well, I believe that we're about to face a real tsunami in health care. The changing demographic makeup of the communities we serve and the patients that come out of those communities are increasingly and rapidly becoming more and more diverse. If we don't address the diversity management problem and the disparities challenges in terms of quality medical outcomes, hospitals are going to find themselves in a really tough financial situation. I don't believe that we can improve quality without eliminating disparities. I don't think we can improve bottom lines without eliminating disparities. So while we look at disparities based on the race of gender, age, sexual orientation, race, religious differences, language differences, what they really are quality and safety issues. So hospitals are not going to be able to achieve their quality goals or their financial goals based on reimbursement without addressing satisfactorily these issues of disparities and diversity management.